At this ASH, I presented as the first author 2 abstracts. The first one is chemo-free therapy with AVR, Acalabrutinib, Venetoclax, Rituximab in frontline mantle cell lymphoma. Among 21 patients in this abstract, the overall response rate was 100%, and the CR was up to 92%. So chemo-free therapy, as you can see, is very powerful. Even with the chemotherapies, the response rate is about 40 to 50% at most. But chemo-free therapies are able now to induce the higher CR rate among frontline treated patients, meaning patients with newly diagnosed, not treated, and mantle cell lymphoma patients. So not only this triple chemo-free therapy was successfully reported, but also other triple combinations of the frontline was also presented, such as the R2 plus Acalabrutinib presented by Dr. Ryan Jia from the Cornell hematology group. So basically, we are able to achieve CR around 90% and the overall response around between 90 and 100%. So the chemo-free therapy has been confirmed to be powerful, and that this kind of efficacy could replace chemo-free therapy. And this is what's happening now, and that chemo-free therapy will replace chemotherapy. As we all know, chemo-free therapy has long-term toxicities, such as secondary malignancies. That's not curable. So a lot of the people came to my poster, and they obviously understand the chemo-free therapies are replacing chemotherapies, but at my poster, and some colleagues asked me, Dr. Wang, do you think chemo-free combinations is curable? My answer is largely not. Then, what is the next step out of chemo-free therapy if they are mostly not curable? And I basically explained that a chemo-free therapy could induce long-term remissions to a profound complete remission, but they are rarely, most of the time, they are not curable. And in the future, we are looking for chemotherapy free, but with the targeted agents, antibodies, with a bispecific antibody, trispecific antibody, or CAR T-cell therapies. The combination of antibody therapy and cell therapy or bispecific antibodies with a target agent, in my opinion, will induce even longer remissions and will replace chemo-free therapies. And so what is the name for the upcoming therapy that will replace chemo-free therapy? I call it targeted immunotherapy combinations.